Good afternoon, everyone. Today is April the 17th at noon. Alan Harris here with the Seminole County Office of Emergency Management in the Emergency Operations Center. Today we've been working on personal protective equipment, getting those pieces of equipment out to assisted living facilities, nursing homes, and hospitals, and also, of course, working with our individuals with COVID-19 that are tested positive with COVID-19, as well as the individuals that are currently monitoring and persons under investigations, those that are isolating and quarantined inside their home. Currently here in the county, as of just a few moments ago, we are at 313 positive cases of COVID-19 in the county, and 218 of those are completed. So completed, again, that just means that they have no signs and symptoms and they have met their entire quarantine and isolation period. So we are starting to see, as I have mentioned a couple times, a downward trajectory of individuals that are positive in the county. We've also seen a slow decrease or slow leveling, if you will, of individuals that are positive or coming back with positive tests. So hopefully that is a good sign. It looks like it's a good trend. We're excited that it could be a good trend, and what that just means is, from the modeling, from the things that we are seeing, from all the statistical analysis that's sent to us from IEM, from the Florida Division of Emergency Management, from CDC, is that people in our community are following the guidance, and they are social distancing. They are not getting in large groups and gatherings and things like that. So we are starting to see that, and we're starting to see the benefits of that, and hopefully that will continue. Unfortunately, over the last 2 days, we have had the report of our third and now our fourth, we were informed this morning of our fourth fatality. So very sad. We were hoping to get through this event without any fatalities whatsoever, but we are now reporting our third yesterday and our fourth fatality here in Seminole County. So it just reminds me, at least, that we still need to continue the social distancing. The numbers are looking better, but this is still a serious illness, and we want to make certain that our first responders, our healthcare workers, those that are in essential businesses, our grocery store workers, as well as you, our residents, stay healthy and safe during this event. We wanted to let you know, of course, that we are still here 7 days a week. We will continue to be here 7 days a week. The Citizens Information Hotline is available for you at 407-665-0000, 8 a.m. to 5 p.m., all 7 days, staffed by Florida Department of Health and Seminole County Emergency Management staff. Also, the website is available, prepareseminole.org. Again, prepareseminole.org. And today, our Citizens Information line, actually over at the end of the day yesterday, they hit over 5,000 COVID-19 related calls. So that was a milestone. So we are very proud of the individuals that have been in that room answering your questions, and I hope those questions have been answered helpful. I know that they get all types of questions in there, and they've always tried to be very, very helpful to our residents. They do a great job over there. There's only a few of them, but they do their best to answer the calls, and if they can't answer your questions, they will certainly get your name and number, and they'll call you back once they've researched it with the proper epidemiologist or whatever the question may be. They'll get you the answer. So sometimes they may have to call you back because the answer may not be readily available depending on the type of question. Denise asked, why are numbers not being reported? The number, I think what you mean is the number of patients versus the numbers of individuals that are coming off of quarantine. And unfortunately, I can't answer that question for you. The Florida Department of Health reports those numbers, so I can only report the numbers in Seminole County. So we are seeing that, certainly there are people recovering, right? There are people recovering across the state of Florida. I can only get the numbers for Seminole County. So I can only tell you who has completed And I've always tried to be very, very upfront here on Facebook Live with those numbers, and even on the press conferences, but certainly here with you all, because it's kind of a intimate, if you will, chat with you all. We try to answer your questions and communicate the best that we can. We've done that. We've tried to do that the best that we can using this. So while other counties may not be reporting, just because they can't, they're not allowed to, we are trying to report those recovered cases. So again, and I'm going to look at my board over here because that's where I have to look. 218 individuals have completed their isolation and quarantine. They are better now. They feel good. They are no signs and symptoms. Their fever's out. They don't have the cough, the shortness of breath, and things like that. So it's a great thing to report, and we always try to report the good. And unfortunately, we have to report sometimes the bad as well, and that's our 2 additional deaths. Lacey asked, where do salons fit in the phases? So the executive policy group here for Seminole County. So the executive order for the state of Florida has closed down non-essential businesses. In Seminole County, we never issued anything that listed essential and non-essential businesses. Not in any of our orders. We never have written that into any order because we did not want to hinder any businesses from continuing to operate. All we wanted to do is require social distancing. So the measures of 6 feet in between individuals, no groups of 10 or more. Unfortunately, it did affect a few industries, and the hair salon industry was one of those. So we've already discussed how once the state's executive order, again, the state's executive order talks about the non-essential businesses being hair salons. Once he rescinds that order, once he says those salons can get back into operation, we certainly don't want to prevent that here in the county. We will already have plans. It's already drafted. It's not ready yet, but it's already drafted that we will rescind and adjust our executive order to absolutely allow hair salons, nail salons, massage therapists, tattoo artists, car sales, test drives in the car, things like that to be done safely, but to be done. So there are a lot of safe ways you can do that following the guidance on the Open Up. And we're going to do that here in the county. We're going to follow the guidance and Open Up America, and when we get to that phase. So we've been looking over those phases, and we'll continue to do that. When can we be in phase 1? Doug asked, when can we be in phase 1? So according, I'm going to pull it up real quick over here. So according to the guidance put out by the White House yesterday, I'm just going to go through it real quick. So we have to have ample test sites available. So I believe that, we do. We have 20-ish, 21, I believe now, test sites that are available. And I listed those the last time, so I won't go through each and every one of them because we only have a short period of time together here today. But there are 21 test sites. Now, what I will let you know is that we are planning 2 drive-through test sites. So I know the regional site was the only site in the Central Florida area, and that's because it was staffed by federal government and state government individuals. But we are opening 2 drive-through test sites in the county next week. So the logistics isn't quite complete yet. We're just getting some things together as far as the tents and things like that. We just need to make sure that everything is on the ground, ready to go. But our plan is probably very early next week, if not midweek, that we will have 2 drive-in test sites here in the county. In addition to that, we are going to do pop-up test sites in our more low-income communities. So those are East Altamont, Midway, Goldsboro, Lincoln Heights, Bookertown, Georgetown, and Jamestown. And we're looking at doing day stops in each one of those, and then going back to the ones that have the highest demand. So if we go into Midway and we're seeing a demand of maybe 20, 30 people, then we probably won't go back to that neighborhood because we've fulfilled the entire request. But if we go into maybe Goldsboro and we are starting to see large lines of cars of people waiting for tests, then we certainly will come back and do another day there, but we have to get a feel for what that's going to look like. So that will also start next week, and there'll be announcements on that over the weekend. So tune in here to Facebook Live for those. So that was one of the key factors for getting to phase one. So we're starting to do, and we are doing that. And there's another part of phase one, and that is, it says the ability to quickly and independently supply sufficient personal protective equipment. So we're not quite there yet. We are starting to get PPE in, personal protective equipment, but it is spotty. Some of our healthcare facilities are low. So I'm not sure that the governor would say that we're statewide at a point where we can do this. And we have not seen that in the county. We have been providing PPE to our assisted living facilities and nursing homes and hospitals, but is it coming in quickly and independently? No, it isn't. Quite frankly, between you all and me, it is not. We are praying some days that we'll get a shipment in, and we have been blessed to get a shipment in, but sometimes we're right to the wire, and then we get a semi show up, and we're able to fulfill the needs. No one has been without. But we have gotten close in quite a few hospitals. One hospital was down to 24 hours, so we never want to be in that spot. But thank God a semi from FEMA pulled in right before that, and they came here to the logistics staging area. They dropped off the supplies, 12 pallets of supplies that day, and we were able to quickly get it over to the hospital, and they were able to, of course, maintain operations. The ability to surge ICU capacity will help us get to phase one, and we have worked with the hospital system to make sure that they are able to surge ICU beds, and in some cases we've ordered additional beds from the Army Corps of Engineers so that they're able to surge in some of our hospitals. Of course, social distancing, so we already have that in place. We have an order in place for that as well, so we've already met that particular criteria. The protection and health of people living in high-risk communities like ALFs and nursing homes, assisted living facilities and nursing homes, we meet that criteria. Protect the healthy and safety of workers in critical infrastructures, we've met that criteria. So there's a lot of criteria that we have met. Again, the PPE is probably the one of the items that's kind of hanging out there. Now, the other thing that gets to the phase one is a downward trajectory of illnesses reported in the last 14 days, and we have started to see a downward trend in the number of new cases, so that's good. Downward trend in documented cases over the 14-day period. So that has been up and down. So we are going to have to look at that to see if we're doing it. And I know if the governor looks at it statewide, then probably not, because South Florida is still seeing large amounts of cases. If he looks at it regionally, then maybe the Central Florida area would get to phase one a little bit faster. If they add in Miami and Broward County, it'd be a little bit more challenging to get there. And then the hospitals treat all patients without crisis care, and I think that we are close to that right now. Diane asked, how will gyms open with social distancing requirements? So in our order, we talk about businesses that can operate, and businesses that operate have to have the 6 feet distance. So that's still the CDC guidance. So that's still the request that we have for our gyms, that there are no groups of 10 or more people. So that is still in there. And then the 30% occupancy. So gyms can still operate once the executive order from the governor is rescinded. Right now, the executive order for the governor says that gyms can't operate. So gyms have been very creative, though. So some gyms have done small groups out in parks. That's fine. They're not inside their gym. They're not inside. They don't break the executive order. So we've heard of some very innovative things. Some have gone for runs. Some have done small classes, calisthenics, and keeping the 6 feet distance and stuff like that. So some have been very, very innovative how they have continued to keep their businesses flourishing. To some level. Barbara asked, how do people without transportation get to a test site? Please call our Citizens Information Hotline, 407-665-0000. Again, 407-665-0000 for information on how to get to a testing site if you do not have transportation. Alexandra asks, so Seminole County can open now. Seminole County cannot exceed what the governor's executive order has said. So the governor's executive order lists essential and non-essential businesses, and those non-essential businesses listed by the governor, Seminole County cannot say that they are an essential business in the county because he's already said that they are non-essential for the entire state. So we can't trump what he has said. So we are ready and poised to open. We want all of our businesses to be able to open safely when it does come to that time. But it is really the governor's call when we are starting to get to phase one, and then when he rescinds that particular order. Jennifer asked, "Are you having people go to homes that are in quarantined?" Yes. So and test relatives. So yes. So. As I said, we have roughly 300 individuals. I was looking over at one of the dashboards over here. We have right at 300 people that are isolating and quarantining in their homes. So in some of those cases, we're sending individuals out with food and water and medical supplies and things like that. And in some cases, we're doing temperature checks with those individuals. So we're getting their temperatures each day. So that it just depends on the case, and it depends on what their status is. So if they're a confirmed case, then we're just checking on them regularly. If they are not a confirmed case, then we're getting their temperature checked. So we provide them a temperature gauge, and then they take their temperature, and then we get those temperatures each day to see what the level is and to see if it's going up, and if we need to continue with their isolation quarantine, or if we need to maybe even test them. So we're looking at that. My son is a student driver. Is it better to stay off the roads? So we're actually seeing pretty low low amount of traffic on the road. So I think probably now would be a safer time to drive than any other time. So there's not a lot of people out on the road. There's a lot of people that are sheltering in place, staying at home. So now would probably be safer than the normal traffic in the Central Florida area. We are seeing very, very light traffic at night, if not all, and that's why Seminole County has never even thought about issuing a curfew. It's never been on our mind. We've discussed it one time just to say, hey, just want to confirm everybody's good with no curfew, and everybody said yes, absolutely no curfew, and we went on, and we didn't even discuss it any further than that. Joshua asked, will Seminole open without a working drug to combat COVID? Yes. So so that's 18 months at least is what we're hearing from some of the professionals. So yes, Seminole County will open up businesses in the phase one using the Open for Up America guidelines. We certainly plan to prepare to open up as best that we can. So again, that requires Governor DeSantis to rescind the order related to non-essential and essential businesses. And as soon as that is done, then we will modify our executive orders at that same moment to make certain that all businesses can open up and they can open up safely. Our school's going to open. Jamie asked that. So right after this, 12:30, the school board will have their Facebook live chat, so hopefully they can answer that question for you. I think it is best probably for their Facebook live, not necessarily mine. I don't want to speak for the school board since they have their own live chat, but please, Jamie, tune in to the Seminole County Public Schools. We'll be going off the air here in 5 minutes, so that I'll give you 5 minutes to get onto the school board, and certainly please ask the questions ask the questions about that. Where can you find the active positive cases? So they're all over the county. So I'm looking at another board. There's dots all over the map in Seminole County. We have a heat map. And the heat map's on Prepare Seminole, I believe, right? We had it on Prepare Seminole. I know at one time what we'll do is we'll post it to this as a comment, so you'll be able to see the heat map, and then you can see. But the heat map pretty much just shows the positive cases being our most populated areas. So you're going to see the darker reds over Oviedo, Altamont Springs, and Sanford, and of course that's because there's more people in those areas. But if you look across the county, most of it's pretty much dotted across the county pretty evenly, but obviously more heavily in the areas where there are more people, right? How is the West Seminole Boulevard project essential? So Eddie asked that question. So all construction businesses were listed as essential. In fact, DOT even was encouraged to increase the amount of construction projects. So a lot of construction projects were fast-tracked. That again is a state of Florida order. So we are working very closely with that. When will the courthouse reopen? So it will be done in concert with those changes in the executive order. We've been having some conversations with the clerk of the court to figure out when that would happen. And of course, that's going to happen in concert with the county reopening, with phase 1 starting. And so we're going to be doing that all at the same time. Again, we have to get to that. What phase is non-emergency dental considered? That is a good question. So what I'm going to ask, or what I'm going to suggest, is if you go to whitehouse.gov, whitehouse.gov/opening America, it lists all of that down, and I believe it is in phase 2. Yes, phase 2, elective surgeries can resume. So phase 2, elective surgeries can resume. And again, we're just trying to get to phase 1 right now, but phase 2, it does say elective surgeries can resume. How is recovery determined? Adriana, great question. We are working on the recovery process right now. So we want to get open for business. We want our businesses to open up. We want our economy to rebound. So we're working on that process right now. We're working on how we recover from this at a government point of view, and then of course at a business point of view too. We're trying to help our small businesses reopen. We've been working with the chamber. We have another conversation with them this afternoon to talk about how we can provide assistance to them, the chamber, and the small businesses as they start to reopen. And we have multiple chambers here, so we have a couple conversations actually with them scheduled over the next few weeks, but the one we're going to talk with today is the Oviedo Winter Springs Chamber of Commerce. Testing for large populations, large workplaces. So Shane, we would love to do individual test sites at businesses. We simply just don't have the medical staff. It takes a large amount of medical staff and equipment and logistics to open up a testing site. And that's why it's taken us a little longer. The regional site was opened by the federal government, by FEMA, by federal officials, National Guard troops, things like that. Unfortunately, they just didn't have enough to go into each county. So it took us a little longer to get the nurses together, the doctors together, and things like that. So thank God we have been able to get to that point. And now we are very, very thankful that we have the nurses, the doctors in place, the logistics, all the equipment that is necessary to open up the drive-through test site next week. In phase 1, what can restaurants do? Judy asked. Well, they specifically talk about restaurants, and they say sit-down dining can operate under strict physical distancing protocols. So strict physical distancing protocols would be the 6 feet distance in between you and the next person, meaning you and the next person that you don't know. Obviously the family can sit together, but you and the person that you don't know. So 6 feet distance. In Seminole County, we did the 30% occupancy. That's very consistent with strict physical distancing, and just not large groups. And we've seen that across the country, that's still the recommendation from the CDC and the White House. So just not very, very large groups in those locations. So I'm not saying, again, 30%, I'm not saying 10 or less people in the entire restaurant. I'm saying 30% of the restaurants. So those capacities can be quite large. So as long as they're doing social distancing, restaurants will be able to reopen, and people will be able to actually have in restaurant dining, which will be really, really nice. Looking forward to that myself. John asked, could you have sports teams practice in phase 1? It does talk about youth activities, and it says youth activities must remain closed. We are going, and it doesn't really necessarily talk about parks. So we're going to have to talk about parks and that, but it does say gyms. So it says gyms can open with the physical distancing and sanitation protocols. So we certainly would encourage our gyms to open up, and if gyms start to open up, then we will certainly look at reopening some of the parks, the softball complex, the tennis courts, all of the other complexes to allow people to do sports. Again, doing social distancing as best as possible. Dorothy, where can I get tested? So on our website, we list all the 20-something testing sites. But next week, remember, we're going to have those 2 drive-in test sites. So if you're not feeling good right now, though, go to a testing site and get tested. The 4 hospitals, the 3 emergency rooms. Remember, Heathrow is closed right now. They're a standalone emergency room on International Parkway, but the other ones are open, so you can go to the standalone emergency rooms as well as the urgent cares that we listed. Again, it's on prepareseminole.org. Sandra asked about mask recommendations and requirements. So, Sandra, we did not issue a mandatory mask requirement here in the county. We certainly have recommended it. We highly recommend it. We very much encourage people to wear masks and wear them appropriately. So we would encourage you to do that whenever you leave the home. I know I do. When I go to the grocery store, I always wear a mask now, making sure that you cover the nose and the mouth. Don't just cover the mouth. People have done that. About 50% of the people that were in the grocery store had their mouth covered. They didn't have their nose covered. So unfortunately, we are at 12:25, and I know there was a lot of other questions here. I'm seeing them, but I really want to thank you all. We try to provide good information to you. We've tried to be very, very open during this very unusual disaster. Oh, I wanted to tell you one other thing. We have not forgotten about the upcoming season, of course, hurricane season. So we've been doing some planning on hurricane season. The sheltering of yesterday is of yesterday. So we've been working closely with Walt Griffin, the superintendent of schools, as well as the school system. So we're looking at some safe ways to open up emergency shelters. Heaven forbid we have a hurricane this year, but I wanted you all to know we are planning and we are preparing for that, and we certainly have not kept our eye just on this. We are also looking in the future for future events, and if COVID-19, which is projected to be with us for a little while, if it's with us and we have a hurricane approaching, we are looking at safe ways to shelter those people that need to evacuate in times of emergency. So with that, I'm going to let you go over to the Seminole County Public Schools Facebook Live, and I hope you all have a wonderful weekend. Thank you very much.